attention being given to the rise in COVID infections in the country and in the state. And I just want to update you on where we are in Detroit and to reinforce a message about what we need to do. Let me start with the chart, which is nothing but good news. You can see the weekly numbers. You remember at one point we were losing upwards of 250 people a week. This last 7 days, the first 7 days of July, we had one death in this city. That's a rate that I didn't think I would ever see. So we've brought the numbers down dramatically. And if you look in the hospitals, as of today, 13 people are in beds in hospitals in the city of Detroit. If you go back to April, that was 250 people. So we're down 95% on the number of people who are on beds. That all sounds good. And all you have to do is look at that chart to see why Detroit is a national model for having dealt with COVID-19. But we're starting to see some early signs of trends that are concerning. The infection rate is rising in the city, not as fast as it's rising in the rest of the state, but you go back a few weeks, we were basically seeing about 10 new cases a day. The last week or so, it's been 20 or 30 cases a day. Now that's nothing like the 300 cases a day we were seeing in April, but it is a concerning trend. It is going up much faster than that in the suburbs and much faster than that in other parts of the state, which is causing the governor to react the way that she is reacting. And we have to stay on top of this in the city. And it really is a basic thing. 80% of this is wear a mask. It is remarkable to me the way the protests have not generated any noticeable spread of COVID. The one thing about the protesters is they're very diligent about wearing masks. We have more than 5,000 city employees coming to work every day. We have a below 1% infection rate. Our employees are wearing masks, they're practicing social distancing, they're having their temperatures checked. But I had an employee come to me today and say, I went out to Meijer's and saw people shopping in a store without masks. I felt more scared going out to the store to pick up milk than I felt coming to work every day. And so we're starting to see some bad habits start to come back. There's no mystery to why the numbers on that chart came down. The people of this city embraced masks and social distancing almost like no other city in America. But if we don't stick with it, we're going to end up back in the same boat. You're going to be wearing a mask and you're going to be inside your house. And so I have been arguing for a while to the governor that I believe that the city of Detroit is acting responsibly and we need to keep reopening the economy. And Denise Fair and the health department and the police department have been going out every Friday, Saturday night to our various restaurants and bars. We've had very good cooperation and compliance at our restaurants, for the most part at our hair and nail salons. But a lot of these neighborhood gatherings where people are packed in tight groups without masks, this is where our risk is. Going into a store and not wearing a mask, where the air is circulating among a lot of people, is where the risk is. And I know that Director Fair is going to talk about this more, but as a city, we have made extraordinary progress. And I'm not going to, this is not going to be a week or two. You're going to be wearing a mask in October and you're going to be wearing a mask in December. That's just the truth. If we're going to continue to be able to function every day, we need to understand the fact that half of the transmission of COVID in this country has come from people who don't have symptoms. When you're wearing the mask, you're not protecting yourself as much as you're protecting your neighbors. And so we've made enormous progress. It was a successful week, but now we need to stick with it. I'm sorry. So I'm being told it's better with the microphone. You could have just told me that. Okay. So hopefully that came through well enough with the microphone, but it'll come even better because this is going to be a little bit more complicated. In reopening business, we have got to continue to work to rebuild the Detroit economy. And Kevin Johnson and the Detroit Economic Growth Corporation have been absolutely outstanding at supporting the small businesses of this town. You look at all that we did on Livernois, you look at all that we're doing on Warren and on Kercheval and so many other places, small businesses opening back up, and then all of a sudden, their customers dry up. We don't want to have a bunch of empty storefronts. And so DEGC started out in April, and I'm going to take the business folks who are listening through this, because this is a little complicated, but there is a lot of money available very soon. So in April, Kevin Johnson and DEGC awarded nearly $4 million in grants to Detroit small businesses, enough to just keep you going. 741 Detroit companies, they got grants of $5,000 to $7,500. They were able to pay a rent, they were able to pay a mortgage payment, make some payroll, and stay a little bit more afloat. It was a help, wasn't the solution to their problem, but at a crunch time, it was a help. Now, that was $4 million. Next week, Detroit small businesses are going to have another $7.25 million available in grants from the state of Michigan, thanks to the governor and the state legislature. That's just for Detroit businesses. And I'm going to show you what you have to do to get them, because you're going to have to act quickly. It's going to be grants this time up to $20,000. So before we were only going to $7,500. These are grants for up to $20,000 to keep your business going. It's for small companies. This isn't the big corporations, but if you've got 50 or fewer employees, these pay your basic bills, your payroll, your mortgage, your utility bills, whatever your ongoing expenses are. If your business has been hurt financially due to COVID-19, and besides Amazon, I think pretty much everybody in America has been hit by COVID-19, you can be eligible for these $20,000 grants. Now, here's the complicated part. You may need to watch this a second time, and if you know your friends, tell them to talk about it. The process opens next Wednesday, July 15th, closes August 5th. It's going to be very quick. If you miss this, your $20,000 grant opportunity is gone. And we're talking to you today so that you are ready right on July 15th to get in your application and be at the front of the line. The money will be passed out in September. This is going to be fairly quick. For government, this is extremely quick. The state will have the money in your hands in September. And the details are on the state website at michiganbusiness.org/restart. But here's what you need to know. If you got an MEDC grant in April, you are not eligible to apply a second time. And we're going to help you through this. If you haven't got any grants before, you don't have to worry. Let's get your information ready. Let's get your application in on July 15th, and DEGC will help you. DEGC, I told you, gave out 741 grants in April. This is a little complicated, but I need to take you through it. 113 of those April grants were state grants. If you got a state grant in April, you can't apply next week. That's 113 companies who got a state grant. If you're wondering if you're one of them, you got a letter from the Detroit Economic Growth Association saying you were getting a state grant. 628 grants we gave out in April were awarded by us. There's no problem. If you were one of the 628 companies, you can go ahead and apply for the $20,000 on Wednesday. So we have to work through, and this is what DEGC is here for, to take you through the process. You got no grant in the past, go apply for $20,000. You're one of the 628 companies that got a Detroit grant, apply for the $20,000. If you're one of the 113 companies who got the state grant, we're going to have a different way to help you, but you're going to have to follow the process. So, if you're not sure how all these government programs work, Kevin Johnson is going to make it easy for you. You go to the website, degc.org, and they are listing the 113 companies who got the earlier grant, who can't apply on Wednesday. You'll be able to go on there and see if your name's on there. If your name's not on there, you're good to go ahead and apply. If you are one of the 113, Kevin and his team are going to help you go through a process, because there are other grants that there's a good chance you are eligible for. And so we don't want you to have to navigate all this bureaucracy. The DEGC is here for you to take you through it and get you to the place where we can get money into your business so you can keep going. We're going to get through this thing. The economy's starting to open up. There's going to be a vaccine next year. We're going to be back to normal. We need to make sure you're still there in your storefront. And with that, I'll turn it over to the person who's been leading the effort to keep these businesses going, Kevin Johnson.
Well, thank you, Mayor. And I want to reiterate what the Mayor said regarding the urgency and the efficiency, quite frankly, of what we have set up for businesses that, one, qualify for the new grant opportunities through the state of Michigan and MEDC, as well as those who will not qualify but have other means that we have identified that you could potentially be eligible for. The first thing I'd like for you to do, for those who are listening, is to write down this phone number. The number is 844-333-8249. That's 844-333-8249. We have staff available for you to call Monday through Friday from 9 a.m. to 5 p.m. to help you walk through what some of those other sources are. As the Mayor mentioned, it's fairly complicated, but we're making it simple. The first simple thing is to make the phone call. The second thing is have your paperwork ready to go. That way you know that you've accomplished most of what you'll need to do in order to qualify, such as making sure you understand your employee numbers, making sure that you have somewhere your information regarding your profit and loss situation from the time of March of 2020 up through December 2020, which was a little different than when we did this the first time around. So we can extend out where you can anticipate losses based on how your businesses are performing. Wayne County, our partner, has a program called the Wayne County Small Business Relief Fund. There's a $50 million fund that they put out to the market for Wayne County and Detroit-based businesses to apply. So if you're in the category that the Mayor mentioned, the one of the 113 businesses, you will be eligible for applying for that particular fund. The urgency that I mentioned is that for that fund, the Wayne County Fund, that application closes tomorrow. So what I would suggest, if you're interested in applying for that, is the first thing in the morning, get on the phone, give us a call, and we'll help walk you through that application process. So that's just one fund. The other information I'd like to share with you is the Payment Protection Program, the PPP that you've heard a lot about, that has been extended until the first week of August. So if you are in a position where you can get in there and apply for the PPP program, you have now until the first week of August to do that. So that is something that is very important. And again, you can access this information by the phone number I gave you, as well as go on our website, www.degc.org, and all this information will be available to you by close of business today. So thank you, Mayor, for allowing us to share this, and we hope we can do more to help Detroit-based businesses. Thank you.
Thank you. County Executive Warren Evans has been a great leader from beginning to end in this process. So, just take your time. Yes, we're going to do it like this. As I was saying, County Executive Warren Evans has been a great leader on this as well. I know this sounds complicated, but for $20,000, it's worth you taking the time, and you're going to have partners here helping you every step of the way. The other thing that we are very pleased about is on Monday, 8,000 Detroit young people went to work in our summer jobs program. They started Grow Detroit's Young Talent. It was a program we started here 6 years ago because we don't want the young people of Detroit, when they graduate from high school and they go out to do their first job interview, never to have worked before. We just think there's enormous value in having had a summer job experience. And the business and philanthropic leadership in this community have contributed $10, $12 million a year to make this possible. It's been ranked nationally as one of the best summer jobs programs in America. A lot of cities had to cancel their summer jobs programs this summer because you can't gather in one place, particularly with the younger teenagers. In the city of Detroit, Nicole Sherrod-Freeman, who runs Detroit at Work, and Marie Hocker, who runs this program, said, we're going to run this program this summer. And so our young people 18 and over are going to their actual work sites. 1,600 of them are going on site where they'll be working in a socially distant environment. Our 6,400 participants who are 17 and under, we didn't want to expose them to the risk of COVID at job sites. And so we've created work from home. In order to do this, we had a number of our folks who didn't have a laptop to be able to do it. And again, thanks to the corporate and philanthropic leadership of this community, we bought laptops for every single young person who's going to be in this program working from home. These folks went to work starting Monday. It'll be a 6-week program, and I'm really pleased at the fact that this could happen. And Marie Hocker, our director, brought some of those participants with her. And with that, I'll turn it over to the director, who's just done a remarkable job against impossible odds getting this going. Marie Hocker.
Thank you, Mayor. Good afternoon. I'm Marie Hocker, Executive Director of Grow Detroit's Young Talent. We are absolutely proud to be launching the 6th year of GDYT and continue to serve 8,000 Detroit youth this summer, even in spite of COVID. And I sincerely want to thank you, Mayor Duggan, for your leadership and for your vision for ensuring that all of our youth in the city of Detroit have access to economic opportunity, because that is really what this program is all about. Before I share a few remarks, please turn your attention to the screen to hear from a few of our generous sponsors and our talented Detroit youth that inspire us every single day.
Bank of America's continued support of Grow Detroit's Young Talent this year will provide virtual jobs for 125 Detroit youth, better money habits training, and device and connectivity access for another 600 young people. We do this because we know that early access to employment creates sustainable economic pathways for individuals and opportunities that open doors for a lifetime.
Strategic Staffing Solutions has been a partner to Grow Detroit's Young Talent since it first began and every year since then. We fully support its mission because of our belief in the youth of Detroit, and we know that they will gain the real life experience they need to not only build their own careers, but chart whatever successful path they choose to take.
DTE really values the partnership we have with Grow Detroit Young Talent. We're able to get connections with students across the city for opportunities here at DTE.
I'm excited to work with GDYT because every year they give opportunities for us to make our own money and help us learn new life experiences through the different jobs that are available. The career path that I will be focusing on this summer, which is actually my major in college, is forensic science. The opportunity for making this income this summer is important to me because, especially with me going to college, this can really help pay for my books and any other fees that I may need help with. What I'm hoping to gain from this GDYT experience is learning how to adapt to new circumstances and still getting the job done.
What sort of career paths am I looking to gain from GYT this year? Hopefully something to do with graphic design. I'm a really big fan of graphic design. The opportunity of making an income is very important to the GYT program, and it'll just help me manage my money better because I've been working on that for the past couple years.
It's fabulous. We are so proud of our young people. I want to take a moment just to thank all of our generous funders who will be listed on the slide that will come up in just a second, who stood with GDYT in such unprecedented times. Together with our funders, we actually raised $11.7 million to operate this program this year, despite all the odds, and that was 100% of our goal. I also want to acknowledge our outstanding GDYT team, our Summer Youth Employment Coordinator, Connect Detroit, and all of the community-based organizations who work tirelessly to stand up a virtual program for 6,400 youth and secure 1,600 on-site jobs for our older youth. Despite COVID-19, as the mayor mentioned, we never considered canceling this program because we still wanted the city's youth to have a meaningful career experience this summer. Now more than ever, we need to support our young people in building skills to join the workforce, to be more successful when they go to college, and to help with household expenses and their savings. It is also important to note for all of our youth and their families that working for GDYT will not affect your public benefits, including unemployment or your food assistance. GDYT will allow our youth to earn up to an additional $1,200 this summer. GDYT this year is going to leverage 2 online programs. One provides interactive career exploration, and another is an instructor-led platform with exercises that are a lot like being on the job. So as an example, GDYT youth will have the opportunity to participate in manufacturing, IT, healthcare, construction, and customer service learning programs. And youth will also have a chance to interact directly with employers who work within those industries. They'll engage with those employers in online meetings and in workshops. To earn their pay this year, youth will have to finish their daily assignments, their group assignments, and a final project. GDYT Online would not have been possible without the support of our sponsors and our community leaders who ensured that all GDYT participants had access to devices and to internet service. 40% of our youth will receive a laptop through Detroit Public Schools Community District's Connected Futures Initiative. 60% of our GDYT youth will receive a laptop and internet service through the generous contributions of Bank of America, of the Skillman Foundation, of Quicken Loans Community Fund, and Rock Families of Companies through the Connect 313 partnership. In addition, the Valade family and the Wayne Metro Action Agency. We could not have done this work without you this year, so thank you so much. It's so crucial to have philanthropic partners, and today is also the day that we want to recognize our employer partners as well. More than 90 employer and industry-led training providers offer virtual or on-site work experiences, and I want to thank them for giving Detroit's youth access to opportunity to learn, to contribute, and demonstrate their capabilities and talents. So without further ado, it's that time to hear from our Detroit's very own young talent, Haley Samuel. Of all the partners that we have, none could be more important than our youth.
Good afternoon. My name is Haley Samuel. I am 17 years old, and I am a graduate of University Preparatory Academy High School, class of 2020. I have been a member of GDYT since the year of 2016, and I am looking forward to my transition from high school into the business world. GDYT helps motivate me and to make me more professional whenever I am dealing with clients or my boss. It is important for me to be a professional because those are key factors that I need within my journey. With the issues concerning COVID-19, GDYT has done an amazing job with providing teens like me with work all around Detroit and from home as well. They also provide us with the second chance to make a difference within our community and within our city. Thank you.
Well, you can see why we are investing in these young people, and I'll be looking forward to you having a good summer. The last piece, Denise Fair has done such a remarkable job on COVID, and she's been out personally visiting bars and restaurants for purposes of inspections lately, and been a big part of making sure that everybody abides by the rules. But in addition to that, with the heat wave, there was a real need, particularly for seniors in this community who don't have air conditioning, to get to a place where they could be safe. And she did a great job of getting our cooling centers up and operating. And so I want to turn it over now to the Director of the Health Department, Denise Fair.
Thank you, and good afternoon. So I do want to spend some time sharing what I'm seeing across the city. As of today, there are 11,870 positive cases and 1,452 deaths. Now, over the past few days, we have not seen that many deaths, and of course, one death is far too many, but that is also an indicator of progress. However, we still have so much more work to do, and it's important that we do not become complacent. So here's what I'm seeing. Across the state, the number of cases are spiking. However, in Detroit, we're only seeing upwards of 25 to 30 cases per day. Most cases are asymptomatic, meaning the individual is experiencing no symptoms. Also, nearly 1/3 of these new cases in our city are between the ages of 20 to 29, and these are our young people. That's why it is so important for everyone to get tested. You can still get tested at the state fairgrounds so that you know your status. Now, should you test positive, know that the health department will call you as part of our contact tracing efforts and discuss your symptoms. We're going to ask you who you've been in contact with, where you have been, in order to protect others from the virus. And it's so important that you answer the call when we call you. Now, although cases in Detroit may not be spiking as with other cities across the state of Michigan, we are not out of the woods. We are still experiencing active transmission in our city. Let me assure you, this is not a game. This is not a joke. COVID-19 is still very much real. We have made so much progress, and I refuse to allow us to revert back to a time when our city was practically empty. Most all of us, aside from essential workers, were under order by the governor to stay home. Most all of our businesses were closed, and the number of cases were rising exponentially each day. And as the governor mentioned today during her press briefing, that's the last thing any one of us wants. So let's not go backwards. So here's what I'm asking each of you to do as your health officer, and you've heard this before, and I know I may sound like a broken record. Wear a mask. Don't gather in large groups. Wash your hands and practice social distancing. Now, wearing a mask, as I've demonstrated before, it is super simple, but it's an important tool that we can all use to protect ourselves and those we love. Now, Mayor, the other day I was out running on the Riverwalk, and I was disappointed.
With your mask?
With my mask, and it was hot. And I was surprised to see not everyone was wearing their mask. In fact, I counted on my hand the number of people who had it on, and this is unacceptable. The weather is nice, it's hot, but it's nice, and the pandemic is still in our lives. When two people wear a mask, they greatly reduce the transmission. And the other thing, you just don't know who has it and who doesn't. So the best thing we can do is to protect ourselves and to wear the mask. And I'm counting on each and every one of you to do what is right and wear a mask when out in public. Now let me talk to the young people, because there may be times when you are the only one in the crowd who's wearing a mask. You may be going to a party, and you may be considered the oddball. But don't let peer pressure put your health and the health of others at risk. So I encourage you to stay strong and stay safe by simply wearing a mask. Finally, today, thankfully, is the last official day that temperatures are expected to exceed higher than 90 degrees. So let me remind you that heat illness can be potentially fatal. So please watch out for signs of heat exhaustion, heat stroke, which include confusion, hot, dry, flushed skin, cool and clammy skin, lightheadedness, dizziness, and nausea. Should any one of those symptoms occur, please first call 911. Today is also the last day this week to take advantage of the city's cooling centers in partnership with the health department as well as the Department of Recreation. So if you do need a cool place to escape the heat, you can go to Adams Butzel, Williams, Farwell, Kimmany, Patton, and they're open today from noon until 8 o'clock. And of course, if you do go to the cooling center, we're going to make sure you wear a mask. If you don't have one, we'll make sure that you get one. And please refer to the city's website for more information on the cooling centers. And with that, I'll turn it back over to the mayor.
All right, we'll take any questions. You working a double shift today?
You know, east side, west side, I'm all over town.
All right.
I'm like the virus, I'm still here, but hopefully not as virulent. I'd like to start with Ms. Samuels. Can you tell us a little bit about what you're doing as part of the program and how your involvement's changed from year to year, the different jobs you've had?
Yes, so between the year of 2016 and now, I have worked various jobs with training that goes from food work to Healthcare, I trained to be a certified nursing assistant last year, so that helped to open me up to a lot of different fields. But this year, I'm working virtually with DTE. So I'm going to learn more about their company, and hopefully I can acquire more of an internship with them to just further my career.
Okay, and how long does the program run? Does it start at the end of the school year? Is it just starting now, and when does it conclude?
So the program began for me on Monday, and it's a 6-week program.
Okay. And is that fairly typical, Ms. Zucker?
That's correct.
Okay. Okay. Talking about the, Mr. Mayor, you mentioned the ventilators. There was a point where I think New York was looking for 40,000 ventilators, and they were hard to find, and I don't think they ever got the full 40,000 ventilators, and there was a lot of concern about whether there was enough ventilators out there. Was the need for equipment like that overstated, or where do we stand in terms of things like that that we thought were a priority, but now don't seem to be as important?
Well, they weren't overstated in New York. They had 2 people to a vent. In Detroit, we knocked it down. I don't know if our chart will come back up. Apparently it won't. But in any event, we knocked it down so fast, we never maxed out on the ventilators. But had we gone up, hang on. So if you can see where we were, had we gone up another 2 weeks, these guys are such a big help. Okay, well, you got the idea. Had we gone up another 2 weeks off this chart, we would have been in the same boat New York was, 2 and 3 people on a vent. You remember they built out 1,000 beds over at the TCF Center. We never got above 16 patients there, and it was because, unlike just about every place else in the country, we leveled off so fast and came down. Now, Houston, Arizona, some others may be in a New York type situation before very long. We maxed out somewhere in the range of 250 or 300 people on vents. Today we have 13. So Detroit is in good shape today. Now, what it's going to look like in December or January, I can't tell you. We have a lot of work to do to prepare for a potential wave that's concurrent with the traditional seasonal flu season.
And that's a great point, because I'm wondering, do we have enough ventilators now it sounds like we have enough to meet our current demand, but do we have enough in case we have a surge that is as big as people expect, or even bigger, since it seems like we're getting a surge a little sooner than we thought? So
there's a number of things. One is the treatments are so much better than they were in March. A lot fewer people are being put on vents everywhere. They've got a series of treatments that are working short of vents. In fact, I think in retrospect, patients were put on vents too early, and I think it led to some bad outcomes. So the vents aren't being used as heavily. The other thing, though, is this. Conrad Mallett, came out of Sinai Grace and is leading an effort, but in another month or so, we'll be talking about this a lot. Every February and March, hospitals are by and large full. They're full from the seasonal flu with elderly folks who are fighting it. And there's a lot of people on vents with the seasonal flu in February and March naturally. We spiked in April. Had Detroit spiked in February, it would have been far more tragic because those beds would have already been filled. And so you will see us roll out an initiative not just to fight COVID. We're going to need to get vaccines for the seasonal flu. We need to free up every single bed we possibly can. So in 2009, I'll talk about this longer than anybody wants to hear, but in 2009 when I ran DMC and we were dealing with the prospect of an H1N1 so-called swine flu epidemic coming, every hospital in this region went actively through making sure their employees got vaccines, doing things to get ready. I think we as a city and probably as a country are going to need to pay just as much attention to preventing the spike in seasonal flu as COVID, because the two together could do enormous damage to this country if they overwhelm our hospital capacity December, January, February, March, depending on vaccine. I'm not somebody who thinks a vaccine is going to be likely widely used by December, and assuming that it's not, we're going to have a real challenge on our hands, and we're thinking about it a lot right now.
And will the TCF Center be available? And if it is available, will you be able to segregate people from COVID and seasonal flu, or will it strictly be coronavirus?
So the governor has kept the lease on the floor, the upper level of the TCF Center, and we absolutely have it as a contingency because nobody knows what to predict. There is an expectation that COVID is going to follow seasonal flu and surge in December, but nobody knows for sure. We haven't been through a year cycle. But what they had done before was the right thing to do. You don't put very sick people in a convention hall. The protocols they had were people who were getting better and could be moved out of the hospital so the sick people could stay. That was their protocol. People got better so fast we didn't have to use it. But whether they set up a seasonal flu wing and a COVID wing in the TCF Center, the medical professionals will deal with that at the time, but I think that's within the realm of possibility.
Okay. And Ms. Fair, we see fewer people wearing masks, even though more people seem to be buying into the need to wear them. But we also see that as the infection rate goes up, the mortality rate goes down. Are we finding that that maybe this isn't as dangerous as we thought it was? I mean, how do you explain the fact that more people are getting it and fewer people are dying? And is that a factor in people possibly saying, yeah, I don't really need a mask, I'll just get sick, but I'll be better?
So it's a really interesting point. We are finding that people may not be taking this as seriously as they did several months ago, and that's very concerning. So I am still encouraging people to wear the mask. We're finding more people are testing, which is a great thing. So they are getting tested, but they're not experiencing symptoms, so they're asymptomatic. We continue to focus on communication and education to make sure we don't experience another spike.
But are we finding that the disease is not as dangerous, or that it's changing, or we're getting stronger, just the weak are gone and now the strong are getting sick and they're shaking it off?
COVID-19 is something that we're still learning about. It's still evolving. Is it dangerous? Yes. It hasn't gotten any easier for us. I think, again, people still need to make sure that they're wearing the mask so that we control the virus. Ray, did you want to add to that?
So just think about what we know now that we didn't know in March. In Detroit, we went through and tested every single person in every nursing home. About a third of the deaths, really around the country, have happened in nursing homes because we were being told by the WHO, by the CDC, asymptomatic people couldn't transmit the disease. That has turned out to be completely false, but that was the information in March. Now, the nursing homes across this country are far more aware and are doing better. There's a whole range of treatments, but I know 3 people in my own life who were sent home from hospital in March or April who died at home because the hospitals weren't able to recognize the serious from the non-serious as they were being overwhelmed. And I don't want to underestimate how much better the medical care is now. I think there's no doubt that the mortality rate would be lower. It doesn't mean it's not still very dangerous. I think they had more than 100 people died in Florida just today. So are the people in their 20s likely to die? No. Are they potentially likely to spread it to their parents or grandparents who are going to be vulnerable, or a relative who's got a bad case of asthma who's vulnerable? Those are the things that we worry about.
Okay. And last question for Mr. Johnson. For those 113 companies that you're encouraging to call, are you also looking for other people to call for that help, or is that helpline strictly for the 113 who aren't going to qualify for this new state round of grant money?
Oh, thank you for the question. No, the helpline is there for Detroit small businesses, no matter what the questions are. But we really want to specifically call out those 113 businesses because of what the reasons that the mayor mentioned, to make sure that we had an adequate pathway for them to address their financial needs as they continue to open up their businesses.
Okay, and are the names of all the grant recipients available?
Yes, the names are available, and we'll have that up on our site by the end of business today.
So that's 113 and the 600 plus
Exactly
that are
right.
eligible.
Yes.
Okay,
Yeah.
great. Thank you very much.
Just one more question for you, Mr. Mayor. The ACLU filed a federal lawsuit today against the mayor and the city in connection with water shutoffs. Wondering if you have comment. That's from Laura Cindy at Fox 2.
So we saw this yesterday. There's some things that are hard to explain, but in March, in partnership with the governor, we stopped all water shutoffs in the city. We went out and knocked on 9,000 doors. There have been no water shutoffs. The governor extended the moratorium through the end of the year. The state legislature just appropriated another $25 million. And Conrad Mallett is heading up the Community Health Corps, which is going to knock on every single door. And it's interesting, the ACLU couldn't find a single plaintiff who had their water shut off to join the suit. So when they called us, we said, just give us the name and address of somebody without water, we'll go out and deal with it. They couldn't find anybody without water. Apparently they sued in case the governor rescinds the moratorium in 2021. So we'll deal with that, but I feel very good about the outreach effort that the water department has made. There have been no water shutoffs in 4 months, and we are dramatically expanding the assistance program door to door right now.